I'm Dr. Erin Elliott.
And I'm Jason Tierney.
I'm a dentist.
And I'm a dilettante. And we're going to talk about sleep matters because...
Sleep matters.
Erin Elliott.
What up?
I want to say that this episode is going to be a little challenging for me. And I want you to calm down and just hear me out here. It's a little awkward because you and I had a podcast together 7, 8 years ago, something like that. And then our guest, Dr. Madan Kandula, and I had a podcast together while you and I were on the outs. And now we have a podcast together again, and Dr. Kandula is here with us as a guest. So I just want everyone to understand there's enough of me to go around.
We don't have to fight.
And you don't have to fight.
I don't have to get hysterical like I normally do.
And I'm loyal to you as a co-host, Erin. Okay? Just know that. Know that as we have this conversation. So I want to welcome my former co-host and fellow contrarian, Dr. Madan Kandula. Dr. Kandula, thanks for being here.
Thanks for having me. Looking forward to it.
Yeah. So how in the heck have you been?
Awesome. Good. Great.
All right.
One of those things.
Awesome and good. For those that are listening that maybe that weren't one of the 7 listeners of our podcast series.
Yes.
Who are you? Where are you? And what are you doing here talking to us?
Oof. All right, I'll keep it brief. Who am I? So I think for the purposes of this podcast,
it's not an existential question.
No, well, I could go there. I'm a board certified ENT by training. I'm founder and CEO at Advent, which is a medical practice based out of Milwaukee, Wisconsin, which is where I'm coming from today. And we are a practice that's focused on what we call the breathing triangle, which is the nose and the throat. So we deal with airway issues. And over time, I've been able to grow that practice from a single, one location spot to currently we're up to 40 clinics across 6 states, and we're growing. I don't know if that's, directionally correct from some of the stuff you're asking up front, but I think I answered your questions.
Yeah.
Or not?
Yeah. Well, I appreciate that. We'll circle back. I've got some more questions about some of that, but just talk to me. I mean, so in dental sleep medicine, so often there is an emphasis on there is a lack of emphasis on nasal breathing. Erin, would you agree with that?
Yes. And I think it's a magic key that not enough dentists, we might mention it to patients, but we don't actually do anything about it.
Yeah. So, Madan, can you talk about that a little bit, the importance of nasal breathing and, sort of maybe in your conversations with dentists or, other referring providers, how you explain that to them?
Yeah. I mean, I think the long and the short of it is, and I'm not to put you on the spot, Erin, but I believe that one of the reasons that it isn't focused on more in dental sleep medicine is that there isn't a good go-to resource when you find somebody who has issues. So and therefore, what I've tried to do at Advent is create that specific solution. So basically, bottom line, if you take pretty much anybody who's sitting down in front of you guys who's got an airway issue, all of them, I'll just make it simple, have something happening in their throat. That's where the snoring, that's where the sleep apnea is actually coming from. Almost all of those same people have issues in the nose. But the problem is, unless you have a way to truly address that, you've got to cross your fingers and hope, and move on. I don't know. That's kind of the long and the short of it. So it is foundational to breathing. It's foundational. What's the it? Nasal breathing makes life possible. It makes, in this case, oral appliance therapy maximally effective. It makes CPAP maximally effective. Yet most people don't have access to the simple things that we can do as ENT specialists to unlock that. And so like that literally is what I focus my entire life's work on, is in creating Advent and trying to expand Advent, is simply allowing patients to have access to the nose and sinus passageways that are open, allowing our dental colleagues, our dental sleep medicine colleagues, access to a tag team partner that's looking to make them maximally successful. Who's their patients and our colleagues that way. And so, yeah, I don't know. I know that was kind of a rambling answer, but I think what I've learned over the last few years in working with the dental sleep medicine community is, I think honestly, I think dentists who focus on airway issues have a profound respect for the nose and its power, more so than the typical sleep medicine specialist. So I don't want to. I would say, so I want to kind of give you the praise as it's due, but both of those camps are stuck with the same problem: is, well, what do you do if you don't have access to somebody or something that can take care of that issue for you and for your patients?
So, what is the breathing triangle? I mean, in more detail.
I mean, it is basically a construct. It's a simple way to think about the airway, and it basically, you take your two nostrils, take those two dots, and that's the upper part of that triangle, and the back of the throat is the bottom of that. So that's an upside down triangle. And I mean, it's on one hand obvious, like those are the three passages that any human being is able to breathe through. Every single person that is struggling with snoring, sleep apnea, nasal obstruction, sinus infections, so forth and so on, has an issue in those areas. Yet there isn't a way to put that together in a framework that people can understand. And the people I'm talking about are patients who are suffering, but also providers who struggle to get maximal relief for their patients. So the breathing triangle is a framework I came up with to help to communicate to others about the importance of this space, the impact of this space, the interconnectedness of these areas. And it isn't. There's a couple things I'm working on that I think will help to get some more traction on that. But currently, I think without that construct, then there's nothing. Like, you have a construct, which is this abstract framework, and then you have the reality of how do you define what other word do you put on these areas to make sure that people understand they're interconnected. And there really isn't one. In a dog, I think we actually touched on this maybe back in our podcast, but like in a dog, it'd be their snout. That's what it is. And so when we were trying to work on the breathing triangle moniker, it was done under the auspices of Project Snout. Like, this isn't going to work.
Yeah.
The snout is not a great go-to-market brand. It's not going to be particularly sexy. So we didn't want to call it the snout. But that's what it is. The breathing triangle is the snout, and because that encompasses the same area. So anyway, how do we get to dogs?
What's your demographic when you started this? Was it to the general public and the importance of breathing? Was it to other providers? And like, how did you approach getting that message out?
I think it was to me, honestly. It starts with, what does that mean? It means like I over the course of my career, I recognized how important and impactful the treatments that I was able to deliver in this area were. And but nobody ever really taught me that. And so it's something my patients taught me it. And then it's like, okay, well, and it's kind of the basic thing is like, I do a simple procedure to get somebody's nose working, and all of a sudden now they're a superhero as far as their oral appliance or CPAP. But I don't have a way to communicate that. And so for me, it helped me understand it in a simple manner. It helped me teach the other folks at Advent it in a relatively simple manner. And honestly, I think that's where we are right now. We've done some work in trying to educate the public and other providers on it, but not enough. So yeah, I don't know if that answers the question, but
You need to go to TikTok.
Yeah, I guess. I
Hey,
think
they
I'm
made
gonna
mouth taping popular, so TikTok
They
can
made a
do
lot of things
anything.
popular. Yes.
Yeah,
This is true. TikTok and other places are, places of thousands and thousands of people who are talking about a lot of things that are in this territory, and some of those things are, whatever, I'd say more reputable than others, but, yeah, it's an interesting
for sure.
space.
Well, I
Well,
used to tell patients to mouth tape the importance of nasal breathing, and they're like, "Are you crazy?" And then all of a sudden, like, "Oh, yeah, yeah, I heard that's good for you."
Yeah, exactly. Yeah, that's how it works.
yeah, I mean, on that topic of social media, and nasal breathing, kind of marrying the two, like intake breathing is a brand that's almost born of TikTok.
Mhm.
What about products like that, like direct consumer products like that? Is there a benefit to patients?
Um, yeah, I mean, it depends on the product. I think, that particular product or those there's, a variety of ones in that lane, which are, yeah, I'd say beneficial, when, in the right situation. I think the challenge with a lot of those things, um, the challenge with any treatment that deals with the breathing triangle, or in this case, the nose by itself, is that if it's something like that, then you're relying on an individual to magically connect the condition they have to this product.
Mm.
And some of those things are like a good fit, and other times they just aren't. It's
They're
knocking on the wrong door.
like, they're
So
looking for the easy button, and
right,
it's not the
and
right
sometimes
one.
sometimes that it's okay. I guess I don't have any specific issue for it, but I'd say generally speaking, blindly groping around for, help, you might, put your hand on something that's helpful, but you might put your hand on a bunch of things that you shouldn't. Um, I don't know, that's what I would say. So I don't there's nothing inherently wrong, but I think um I guess I'll just make it simple, and it's not to make everything about what we do, but I'd say, anybody who finds relief or benefit from a product like that or products like those, would find magnitudes more, impact in a root cause solution, that we can deliver. And so I get nothing against it, but I'd say put me up head to head with that, with the solutions, the actual solutions we have, and it won't even be a contest, because we're able to get to the root cause. We're not about putting band-aids on things.
What about the AAOs? I mean, you sleep medicine, or dental sleep medicine, um, oral appliance therapy. These are things that are certainly, blips, more than blips on your radar. But it
Mhm.
seems like many of your ENT colleagues, um, sleep is just maybe a blip at best on the radar. What do you attribute that to? And do you see, where do you see that going in the next 2, 5, 10 years?
I think honestly, one of the reasons for that is the earlier conversation we had about the breathing triangle is that I think, I guess, what's the difference between me and a typical ENT, as it relates to sleep and airway issues, is
Yeah.
that I view my purpose on this earth to try to profoundly help as many people as is humanly possible. I used to do that with my 2 hands, now I do it with what's between my ears at this point, and that's why I'm here. I mean, it's a maximal, impact across a broad span of individuals, and if that's your purpose and you're an ENT, then sleep and breathing issues are the number one way for my specialty to impact the world. So I
Mm.
see that clearly. Now you go and talk to anybody who's not me in the ENT space, and they wouldn't say anything like what I just said. And they would say, I'm an ENT. I was trained to do certain things. I well trained. I enjoy doing those things, and that's why what I'm here to do. And so I don't think there's any more awareness within the ENT community about sleep issues, about airway issues that they directly have an ability to impact, than there was before. I mean, the only maybe Inspire as a specific procedure and tool is something that is really only done by ENT. So that's a very narrow part of the airway space that my colleagues, many of them are very passionate about. But I think the broader expanse is they don't. It's somebody else's problem, not theirs.
I was just going to bring that up, that even my ENT who does Inspire, I feel like doesn't know a lot about sleep.
No, they don't. No, and again, I'm not trying to knock anybody, but it's simply somebody else. That's most ENTs are whatever you want to call it are really good people, really intelligent people, very dedicated and passionate, but but they want to stay in their lane, and Inspire is in our lane, and so basically they view their role in sleep as if somebody finds their way into my office and they're here because of this very narrow thing that I can offer them, then great. Our Venn diagram just aligned and I can help them. But if it strays out of that zone into something that might encroach on somebody else, I can't do that. I got to put my little blinders.
That's how they are about teeth too. They're like,
Oh,
"Oh, no."
absolutely. Yeah.
Oh, like you're
Yep.
literally staring at teeth when you're in the
Nope.
sinus.
Nope. That's yours. Like, wait, teeth? No, we don't teeth. No, no, no,
No
no.
teeth.
No, no.
You know, at the same time, Erin, I can't help but think about dentists and, oral appliances. I mean, Jill or Joe dentist, patient comes in and says, I want a snoring appliance. And it's like, oh, yeah, I make night guards. I can do one of those things. But, anything beyond that, like, let's talk about home sleep testing or how to make this an integral part of the practice. It's just like, that's for Erin, Elliott, and other weirdos like that. That is not for me. Right? So what about oral appliances at Advent? This is something that you and I have talked about years ago. Uh, and I remember when you were a guest on the podcast that Erin and I used to do. And at one point she said, "Why can't every ENT be like you?" And then years later, as Advent expanded, you grew your reach and oral appliances became a part of the treatment modalities that you offered. I started hearing more and more from dentists about how this guy shouldn't be like this, and there should be 0 Madan Kandulas out there. So, talk to me about the role of oral appliance therapy at Advent and, why there's maybe some of that, look, I just did the 6, 7 thing. Do people still do that? I
I thought
think
we were past that.
yeah, I
Yeah, I
think we're
did
way
too.
past that.
Yes.
Yeah, that was 9, 10.
Yeah.
So, uh, but yeah, I mean, where did some of that controversy come from? Where is it now? But more importantly, what is the role of oral appliance therapy at Advent?
It has a very important role. I guess, what Advent is based on is basically we're looking to deliver simple and effective user-friendly solution to the folks that need it. And, in my strong opinion, oral appliance therapy falls into that zone. And I think that's so it fits in with our line of thinking. It's certainly a breathing triangle, treatment. And so all that's good. And I think where is oral appliance therapy today at Advent? It's in constant evolution. I guess the bottom line is, let me just I won't go through a whole historical story, but when I had one clinic or two here in Milwaukee, life was good and easy as it relates to oral appliance therapy because then me could just partner with my local friendly dental sleep medicine colleagues, and we've got a nice, like that nice 1-2 punch combo back and forth relationship, kumbaya, all is good. But then what ended up happening is then as we expanded beyond Milwaukee, now it got tricky. Because as you guys are well aware, it depends on where you are, how capable and friendly and collegial your local dental sleep medicine specialist is. And so that became a different challenge. And so, so it required a different solution. And we're still working through that. And meaning that what I need to figure out, and I'm not not going to stop until we get this figured out right, is I've got to figure out a way to deliver oral appliance therapy when appropriate to all of the patients who come in to see us at Advent across a clinic footprint that's in 6 states and 40 clinics, and we're growing. And, and it's just been a constant evolutionary process. And we're still in that place where I don't know. We haven't gotten to kind of like, here's the go-to be all end all. And we figured the equation out. It's going to look this way everywhere. There's been some new developments in the space that have come along. I think it's just trying to figure out how to do that. I mean, I'll stop blathering, but I think there's a need that our patients have. Like I'll just make it simple for us. What do we do at Advent is generally we focus on in-office nose and sinus procedures to get the nose working properly. Well, that's good. Well, for somebody who's got sleep apnea, well, that's not enough. So then it's like, okay, then we want to get them likely into an appliance that they're going to tolerate and it's going to get rid of the throat problem that they have. And that, generally speaking, when we want to put options in front of patients, is either going to be a nasal CPAP or an oral appliance. And when you put those options in front of people, most people want the oral appliance, which means we've got to figure out how to make sure those get delivered properly and appropriately. So, yeah.
And not cheaply.
Mhm.
To his credit, he did reach out to me and ask for introductions to dentists that know what they're doing.
Mhm.
And I can assume that it was difficult to find. So if something's
Yeah.
not working, you gotta try something else, and why not take matters into your own hands? But I don't think you were trying to step over dentists at all.
No, I mean, and I don't even, I focus on the things I can control, and I can't control very much. And what I certainly cannot control is the mindset and willingness for other people to understand what I'm trying to do and we're trying to do, and like, can you and work with me? And I know we've talked about this off and on, but like, it isn't normal for an individual practitioner to know or understand what does that even what does it
Sure.
mean and how is it relevant to me? And in general, it's not, and you shouldn't focus on it. Like, that's not something that the typical dental sleep medicine specialist should be focused on. It's like, no, focus on the patients that are in front of you and try to get as many more people in front of you if you're good, so you can help them. So my problem, and I created it for myself, is like, well, I've got this mission, and so in order for me to be true to that mission, I got to solve every problem that presents itself, and this is a challenging one. But again, the good news is there are very good people in the dental sleep medicine community, good companies, good products. There's been tremendous advancement over the last 5 years, 10 years, but 5 years in particular. And so, yeah, I guess bottom line, I don't think, I mean, maybe in 5 years from now, there'll be even greater advances, but I think those products that are truly best in class are so much better than what existed back in the day. And now we're getting close to actual scalability. Like, can you do this at scale? And I think it's still getting sorted out.
Well, some of those advancements you've seen over the past 5 years that are particularly noteworthy, what would some of those be?
I think precision oral appliance therapy. I'm trying not to name specific names. Just, I
Uh,
don't know. Maybe we can,
It's
but I
it's
think
okay. We don't
precision.
we don't have any sponsors, so yeah, you can
Yeah,
name
no
away.
friends, no sponsors or anything. So
Yeah,
that's good.
we're
But
islands out here.
yeah, I would say, just to keep it simple, I'd say I'll use the broad category of precision oral appliance therapy. I'll use the broad category of direct to consumer oral appliance therapy, which I know has some controversy around it. I guess to me, I guess I'm mostly thinking about organizations at this point, companies that are looking to try to solve the problem.
Mhm.
And what's the problem? Most people don't have access to oral appliance therapy. Most people in this country don't. And so I know I think we did an episode on, the direct to consumer companies, and love them or hate them, but they're trying, I guess what I would say is they're trying to come at this problem. Again, if you,
That's not yeah, and from the dentist perspective, that's not how we view it.
I wouldn't. I'm not surprised. I mean, I guess,
Yeah.
well, but but they are trying to come after the problem. Like if the problem is, let's just make sure we're on the same page. If the problem is most people don't have access to oral appliance therapy, then you're trying to solve that problem personally, and a lot of people are. And then these companies are trying to solve it. Now, you might disagree with their product and the ability for somebody to do that in a remote setting, and that's fair. But I'd say conceptually, I think what I think does you don't have to believe what I think, but I think it's like, no, they're trying to actually solve the problem. Whether it's possible, whether it's right, whether it's all the things,
Yeah.
it'll get sorted out.
As a surgeon and a healthcare provider, now that you've dipped your toe in dental sleep medicine, don't you think that there's too many roadblocks? And if we could simplify the process, there'd be more dentists that are doing it?
I don't know. I I
Not that
don't
you can solve that problem, but
that's the thing I don't know. I guess this is the thing that when I think about dental sleep medicine, the thing that I just don't know the answer is what is the actual in the real world appetite for dentists to truly dedicate to do what it
Sure.
takes to be
Yeah.
successful. And what I think I've learned, because dentists are human beings, I think, is that like other human beings, they tend to want to do what they're comfortable with. Kind of what you were saying, Jason, earlier is like, hey, that oral appliance thing, that's for people like Erin and Elliott. It's not really for people like
Sure.
me.
Sure.
And that's what I think. And so, yeah, I think you could hope. And I know you
yeah.
guys have all done a lot of work. You both, in particular, have done a lot of work to try to expand the community and expand access. It's just a matter of what it's going to
Yeah.
take to actually make
I
it happen.
think that, some of those direct to consumer companies, while you're right, their aim to be able to provide oral appliance therapy at scale is admirable, and that goal is desirable. Um, and many people frown upon it just because it's disruptive, or they think that it's potentially, stepping on their toes. It's admirable, it's commendable. Um, it is probably doable. It's just in the current iterations, uh, it's not being done, maximally,
Mhm.
or optimally even. And, that does, I would say, rightfully upend and upset some current providers because they see, look, this is anecdotal. I get that, but I talk to providers all the time, 2 yesterday that see patients that have gotten these devices, by patients that have seen patients that got these devices that took their own impressions at home. I mean, in a past life, I used to train neurology clinics how to take dental impressions for a particular type of splint. And when we would get these impressions at the dental laboratory, like, you couldn't even tell that these were supposed to be impressions of teeth. It
Mhm.
looked like they were impressions of, a cat's eyeballs or something. I don't know. Um, so yeah, there's a lot of work to do there to do it what I would qualify as doing it properly. But the aim to do it at scale, look, I'm not going to be, a protectionist and say there's no space for that. I would say that the way it's being done currently is fairly shitty.
Well, and
Mhm.
I know health clinics, medical clinics that have hired dentists and just have them doing it out of the medical clinic. Makes more sense to me. Um, Jason, do you have anything more on that? Because I do wanna ask him about his actual approach and
Go. I've got
what
it.
okay.
Yeah. Yeah.
So when you talked about the breathing triangle and you get the first step is the nasal breathing, and then you approach the airway.
Mhm.
What and the other thing you said is in office. My sleep person just recently had a sinus surgery.
Mhm.
She had a previously treated deviated septum, but no splints. So when I look at her her nose because I have cone beam.
Mhm.
That is probably the number one reason why I like cone beam for sleep. It's
Mhm.
not even the airway, it's to see nasal
Mhm.
obstructions and
Sure.
sinus. She still had like a spicule and a blocked nares, so he went into the frontal sinus and, she had left-sided sinusitis, and he's like, "It's tooth. If it's unilateral, it's tooth," and I'm like, "I think you don't have enough of an opening, so
Mhm.
you're not draining." Sure enough, that was what the issue was. So I went into the surgery and got to watch, but she was down for the count, and she was in a lot of pain for a couple weeks.
Mhm.
Um, so you do in office. My favorite part about that is that you have to work on awake patients like
Mhm.
dentists do.
Exactly. Um,
It's a whole challenge, but what
yeah,
do you do?
yeah. Yeah, no, I honestly, you guys are, the master class of, you know, whatever surgeries,
Patient management.
procedures on awake patients. And just so everybody's kind of clear on this. So yeah, I don't know, your friend's particular issues, but basically, we can in an office setting under local anesthesia, get the nasal passages open, get the sinus passages open, and you're not down for the count. It's very, very, very analogous to somebody who comes in and gets a filling. Think about typical dental work, and think about a practice that is able to take that same sort of approach to the nose and the sinuses, and think about how much more accessible that is to people, and think about the burden that relieves them of, both the healing burden of going through a surgery that is way more intensive than it needs to be, and then just the burden the more intense something is, the worse that the condition has to be to qualify for it. So with what we do, we make sure that we're getting the right candidates to the right solutions. But so I've got 20 surgeons on staff here at Advent, and then the by far the least likely place that we will ever do a procedure is in the operating room. So it's about 2 to 3% of our patients need to go to the OR.
Wow.
We'll see 32,000 new patients this year across the clinic footprint. So we're seeing a lot of folks. We're helping a lot of folks. We're keeping a lot of folks away from, I would just call it at this point, extreme things that they don't need, and it's a powerful thing. I mean, that's the
Sure.
primary reason that
They're
Advent
most likely to
exists.
say yes when they don't
Sure.
have to take so much time off and
Mhm.
be put under. And
Absolutely.
so you do, like, turbinate reduction
Yep.
and
Yeah, I mean, it depends on the
deviated
situation, but
septum?
very commonly, like, it's very, very common, a turbinate reduction. There's something called a nasal swell body, which is like the turbinate at the top part of the septum. That combination would be the most common procedure that we do. To do something like that, it takes the actual doing of it is about 15 minutes. And they walk in, they walk out, that kind of thing. We do something called balloon sinuplasty. A lot of times we'll do that in combination with that turbinate reduction. So a sinus balloon to expand the natural sinus passageway. I don't know for sure, but almost just I would say your friend that you watched her surgery on, if we had an Advent clinic close to where you guys are at, that I would. I'm not a betting man, but if I were, I'd say I think we could have helped her in an office setting or local anesthesia. She could have got back about her business, and what if it didn't? What if it wasn't enough? What if it didn't? What if it didn't work? Then I'd say, well, we could always go up the ladder to surgery if necessary. And I'd say put that in front of any normal human being, and they'll
Sure.
say, I'll take my office chance. And if I have to go to surgery, so be it. The number of times that we have to take people to the operating room after in-office procedures is even less than the percentage I quoted you before. It's like not even like 1% of those office procedures, less than that, would need to go to the operating room. So we always try to make sure that our patients are fully informed. But I personally, I don't know. Again, I'm trying to make sure I'm on the upswing versus downside. But I find it very troublesome that people right now, as we speak, are going through surgeries in an operating room only because they don't have access to simpler options.
Let me change lanes on you here for a sec. So you've expanded to 40 practices or 40 offices.
Mhm.
You talked earlier, or you mentioned earlier how, most dental sleep practitioners shouldn't be thinking about scale. Um, if you could just give a Kandula MBA uh, one, fortune cookie piece of advice to any of the dental sleep practitioners that are on here that are thinking about their business, their practice as a business. What would that fortune cookie message be?
Are you just so I'm clear, are you talking about somebody who's thinking about expanding and like scaling, or just thinking about somebody who's got, let's just say one location, they've got which
What's the one piece of business advice? How about this? The one piece of business advice from all the things you've learned in your experiences, the wisdom you've gained.
yeah,
What is the one piece of business advice you would give to a fellow healthcare practitioner?
that's a tough one. I'm gonna answer the question. I business advice. I'll go this way. I mean, you can discount, you can negate my answer here, but
Okay.
the way what I've found personally and professionally and in my business life that's helped me, I think profoundly, is to try as much as possible when you're faced with something, a decision, something that you gotta, a problem, an opportunity, is make it as binary as you possibly can. How I do it is make it a fork. It's a fork in the road, and then you've got, with everything you know right now, you got to make a call. You got to go this way or that way. And I think the more I do that for myself, and I force that on others around here. And when you do that, it just sort of crystallizes things. And it also takes you out of the victim mindset. And not everything comes down to two things, but most things actually do. You
Mm,
could pretty well do that. And so then it's a choose your own adventure. Like, I don't know if you remember those books when you were a
of
kid.
course. Yeah.
So then it's like then life becomes beautiful, and business becomes beautiful, because then it's simply like, here it is. We're sitting at this cross. It's not a crossroads. Here's a fork in the road. Down this pathway is this option. Down this pathway is this option. And I would encourage them then to make the right decision. And I think what's the right decision? I would be careful. Generally speaking, oftentimes, not always, but the easy road is the road that's gonna lead to nowhere, and the hard road is the road that's gonna be maybe miserable, but now that's gonna actually get you somewhere further. So I don't know. Again, that's more maybe my life advice, but I'd put it true to business as well.
Yeah.
So yeah.
Is it fair to say also that, you know, I in business and like choose your own adventure book, in one path you might end up bankrupt,
Mhm.
other you might end up wildly successful, but it's not like a choose your own adventure book where like you might be eaten by a dinosaur or step on a landmine. Like you're gonna live. It's gonna be okay. It's probably gonna be okay
I
either way.
cannot I cannot tell you with certainty that the sun is gonna rise tomorrow, so I don't know that you're gonna be okay or not, but I would agree. I think in the grand scheme of things, if you want true business advice, is all anything worth doing has risk involved with it,
Yeah.
and if you aren't able to deal with the risk, then get out of the game. And
Yeah.
honestly, and maybe I'll make it simple because I don't know exactly the audience, but I think for those who are dabbling in dental sleep medicine and are like, I think I really want to do more here. Well, then the other part of this game is going to be, you're going to have to give something up to get something, and you're going
Sure.
to have to take some risk. And there's no certainty. I mean, at the
Yeah.
end of the day, if you're a dabbler in dental sleep medicine and you're looking to take it to the next level, I mean, I'll just be brutally, frank. Are you actually good? I don't know. Maybe you're probably not as good as you think you are. So maybe you're good. And then even if you are good, you probably don't have the chops to make it happen. Now I'm actually trying to like poke them to stimulate them to say like, yeah, I'm good. Who's he to tell me? He
Yeah.
asked me if I'm good or not. And man, yeah. So yeah, we'll get off the couch and then do something. That's my
Yeah.
my
I think
encouragement.
know thyself is the first place to start, and even for me, they're like, "Go out on your own, do just dental sleep," and I don't wanna.
Yeah.
Yeah, I mean,
I just don't wanna.
well, and then they say, well, and then there's reasons for that. But there's also then that's back to the go out on your own or keep doing it the way you're doing it. And you're saying, I don't know if that's easier. I'm going to say that's the road that you've chosen is actually the easier road of those two. I'm not saying
Yeah,
it's the
but I
road.
don't wanna give up, like, the lecturing and traveling I do. So, there's trade-offs to everything. You have to
There's
give
an
up
opportunity
something.
cost. Yeah.
Yep.
And I think that there was a lot and this might have been just of, like, 8 years ago where having multiple offices was the cool thing. And so everyone tried it, but not everyone had the vision like you and the chops to make it happen, and so they did fail, but they weren't doing it for the right reasons, or they weren't the right person to do it.
Yeah, and it's, I don't know, I wouldn't advise it, honestly. It's kinda
Yeah.
what I was saying about, like, I don't know that this is right. I mean, I actually I don't you get to live your life and lead your life, but I'd say I don't think growth for the sake of growth
Yeah.
is because it isn't. I can tell. Let me just make it like a quick story on this. Is when I went, I had literally one office here in Milwaukee for a decade, and then we opened the second one. That was like from '04 to 2014. We opened our second office in 2014, and it was like we just opened another location across town, and that was a shit show. It was horrible. It was like, this is miserable. This is like, I hated everything about it. And that then if I was going to go to a third and a fourth and a fifth, I would that's no, I'm not going to do it. So what ended up needing to change is then I needed to figure out some of these things that we talked about earlier about why
Your
am I
what?
looking to do this? I didn't have a good
Mhm.
answer when I opened the second office. I don't know. I was like, well, I don't know. We got one office that's humming. We'll open this other one, and it'll be humming too. And again, it was not that way.
Yeah.
And so I had to figure out it was only when I understood um, how important I got kind of a bit of an epiphany on there's something that needs to be done, and I'm in a position to do it, and I need to see that through. That's what happened to me. It wasn't about I'm going to open whatever 20 offices or
But
whatever. It's like, and I'm still on that mission right now. It's like, so we have 40, great. I mean, like, good for us. I mean, at the end of the day, who cares? Meaning that what what only matters still is the thing that still drives me is most people in this country don't have access to these simple things we talked about. That's why I'm here. That's why I get up.
you found your uniqueness as
Yes,
well.
correct.
Jay,
Yep,
okay, I have 2 clinical questions before we get to the final countdown. Is
yes,
that okay? So the first is for, like, nasal collapse.
hmm, yes.
Um, is there still no surgical solution? Are, like, mutes and breathe right strips and intake and that sort of thing still like, something you utilize?
There are surgical solutions, and to make it long story short is what you've got going on, which is that collapse, almost that is an issue with the sidewall of your nose. That is an aspect of it, but I would say almost assuredly there is narrowness that's happening on the inside of the nose. Our typical approach for your situation is the low hanging fruit is let's get the inside of the nose appropriately open, and that might either eliminate or minimize the impact of that collapse. Most of the time, it does. And so, in that case, we can get the inside of the nose open, leave that valve area alone. If that's still an issue, so if we get the inside open, it's like, hey, I'm feeling better, but that's still bothering me. Some of those sort of over the counter solutions are fine. There are things that could be done. There's a specific procedure that helps to stiffen the sidewall of the nose is actually very well tolerated, very, very simple using radio frequency to basically remodel the cartilage on the inside of the nose so that it's more stiff. And then there's
Depends.
another procedure where we put a little dissolvable implant in up under the surface it's basically almost like a internal
Like in a tent?
like an tent.
Like
It's
a
almost
little
like it's like a little it's like
hole?
it's a little rod, but it's under the surface. That can work well. My approach is always like I like low-hanging fruit. I don't like mid or high. The valve which is what you're describing, is my personal belief is do not do anything surgical on that until you've harvested the low-hanging fruit. And then when we approach it like that, when we harvest the low-hanging fruit, meaning get the internal issues treated, we rarely need to address that valve area. And when we do need to address that valve area, we've got very simple ways to do it. So yeah.
This is for everyone there.
We need
My
to see
second
it.
question is, once you get them breathing through their nose,
Yes.
do you have anything available or direct them to how to relearn to breathe through their nose and stop mouth breathing?
We aren't as good or diligent on this as we should be because we're probably like you guys is we like to do procedures, then we like to move on to do them to
Yeah.
more people.
And that's okay. I just didn't
So
know if you referred them to anywhere or
we rarely do, and so there's so many things about my organization that I would change if only somebody better was leading it, and so this is one of those. So no, I think again, this is a bit of an issue with scale too. Is if I just had a clinic or two here in Milwaukee, like when that era, myofunctional therapists, people that we're working with, but we don't have the ability to control for that resource at our current size. And so we do honestly, so things like mouth taping, again, mouth taping, if your nose is working is okay.
yeah.
Mouth taping, if you have untreated sleep apnea, is a pretty stupid thing to do. So again, anytime we're going to advocate for it, number one, we're going to know exactly what the condition, like we're going to know somebody's airway. And so if after we've corrected their nose and sinus issues, they're likely still going to want to drop their mouth open, is mouth taping as a reminder, and then working on it. And again, if I were a better person, then we would have more specifics beyond that.
I actually think it's more if myofunctional therapy was covered by insurance.
Mhm.
And there's nothing wrong with that because a lot of people don't say yes. It's not low hanging.
No, agreed. And again, and that's a truth, meaning that part of the like kind of what you just said is, well, why it's a bit of a, I wouldn't call it a blind alley, but if everybody you're recommending myofunctional therapy to and for doesn't move forward with it because it's not covered and it's out of pocket, then what do you do if you're a mere meek human being like I am? Well, you stop really talking about it because it's like, and then certainly if somebody's like massively like whatever, they want to
Still
know,
having issues.
is there anything I can truly do? That's the person. It's like, yes, here's a resource. Let's do that. But yeah, it is an important factor because I mean, bottom line is mouth breathing's bad, nasal breathing's better. If your nose doesn't work and so you've been mouth breathing based off of necessity, we take the necessity away, but we haven't retrained you. We haven't trained the habit out of you. We've only kind of done half the job. But that's kind of as much of the job.
I appreciate your candor.
Yeah.
Sure.
Yeah.
All right. Before we let you go, we're going to
Yes.
play a little game. Are you ready?
I guess so. Okay. Angelo, that's got, I forget his name. It was so bad. We were going to the Sistine Chapel. We watched it. It was the worst movie I've ever seen.
All right,
Can't
we're going to
remember.
find it, and we're going to find it and put it in the the show description. And then lastly, you're getting ready to enter the ring for the battle royale. What's your theme song?
You know what? I'm going to go to the same answer I gave you guys. I'm going to go Power Trip, Executioner's Tax. It is a great walk-in. You walk into that song and you will dominate anybody who dares to get in front of you.
For the new listeners, Jason and Dom, they had a total bromance over their music tastes.
This is
Yeah.
true.
It was like this instant connection.
But you know what? It was. And then, like many relationships, the more we got to know each other, it fell apart. Because then he tried to try to convert me into Swiftyism,
Yes.
and
See?
that wasn't happening. And I mean, so look, I, I, power trip execution is just it's a good one.
We'll
Let's
leave it at
leave
that.
Yeah,
Yes.
we'll leave it at that.
Yes.
Well, Madan Kandula, thank you. I commend you for having such a clear vision and for putting in the work and assembling the team to manifest it, make it real. Best wishes to you and your crew, and thanks for taking the time to talk about sleep matters with Erin and I.
Perfect. Thanks for having me. And
Thanks.
all the best. Thank you
All
very
right,
much.
man. Take care.
You too.
Sleep Matters.